So hi everyone, my name is Eleni Pitsunyaga and welcome back to the second episode of Unraveling Rare by Unravel Biosciences. We are continuing to honor Rett Syndrome Awareness Month by inviting some more special guests with us today. We have Arlene and Ben, who are parents of Luke, a boy with Rett syndrome. And I'd like you guys to introduce yourselves and talk about some unique challenges that you're facing with a son who has Rett syndrome.
Yeah, so I'm Ben. This is my wife, Arlene. This is our 2.5-year-old son, Luke. We live in Dallas, Texas. Luke has a MECP2 disorder and fits in the category of Rett boys. And so he got diagnosed at about 9 months. So we've been living with Rett diagnosis for coming up on 2 years.
Mm-hmm. Yeah, Lukey is 1 in a million. So males with Rett syndrome is very, very rare. We know of maybe about 50 boys that are alive today. With some more that are not with us anymore that we have record of. But yeah, so he's a pretty unique little kiddo.
Mm-hmm.
A little fighter.
Yeah, he is a little fighter. So what's the day-to-day like having a son with Rett syndrome?
Yeah, the day-to-day is complicated. It is a very full day. So Luke has, since Rett, particularly in boys, is a global developmental disorder. Luke has he needs help with pretty much everything throughout the day. So let's start at night. Luke needs some help breathing. So we've got an oxygen machine, and for him a CPAP. Some of the Rett boys have trachs, but for Luke we just deal with the breathing through a BiPAP and oxygen, as well as he needs a lot of help at night because if something's going wrong, he's not able to move and adjust it. So there's a lot of sleep related trouble with this, and particularly with Luke's diagnosis, which results in a lot of sleep trouble for mom and dad. So
and for Luke. He can sometimes go weeks without any sleep.
Yeah. And so during the day, Luke needs help with eating. So Luke has fed almost 100% via G-tube. And we've worked a lot to find a formula that works for him, but he needs help with everything from the eating portion to other motility issues that go along with the disease. Luke needs help anywhere we go. We've got to bring a lot of backup supplies to make sure that we're not out when he has a breathing episode or some kind of apneic event. Which takes a lot of planning and care, as well as every few hours we're administering different medications to help with some of Luke's symptoms. So it's a pretty difficult process to make sure everything's running smoothly. My wife has a giant binder of to-dos that cover all the different things, and it's a little bit overwhelming to see at first because he has a lot of very, very tailored needs. Did you have anything else you want to
add? Yeah, in addition to feeding via feeding tube, Lukey actually gets half of his nutrition via PICC line. So IV nutrition, his GI is just not able to process the amount of food that he needs, so nutrients that he needs to function. So think of the medical intervention, and Lukey has it just to be sitting here today. Other than full breathing support right now, but we're constantly monitoring him on a pulse ox to make sure his oxygen saturations are appropriate and his heart rate is
and also add that there's a lot of therapies, a lot of doctor's appointments. Luke has a great medical team here in Dallas, but it requires pretty frequent and constant checkup with a number of specialists and doctors.
Yeah. This year alone, Lukey, we're in October now, and Lukey spent 3 months in the hospital just because of breathing related issues. So he's a full-time job.
Yep.
Since Luke's condition is so rare, what is therapy and what do clinical trials look like for this kind of disorder?
To date, there has not been a single therapeutic clinical trial that has included males with Rett syndrome. Even information gathering trials have been a fight to get males included. It has long been believed that males cannot have Rett syndrome or cannot have mutations in MECP2 and survive. But Lukey is right here and he is proof that they can. Even though males are much more severely impacted than females are, they're here. So yeah, so it's been really hard. I feel like, I don't know if you would agree, but they're kind of like the stepchildren in Rett syndrome. They're slightly forgotten about. Most literature would say Rett syndrome is predominantly in females, and maybe there'll be a little line saying, and sometimes in males.
How could Unravel and companies that have similar missions help you with actually getting Luke to clinical trials and giving you maybe hope or some kind of, ideation of a future cure or treatment?
Many neurological disorders, when initially diagnosed, look very similar. So most treatments today focus on symptoms alone. So it's just sticking a Band-Aid over a wound, giving them medications to help with GI discomfort or seizures, etc. But I think Unravel's approach to start with the RNA to really identify what is going wrong first and treating the cause and not just the symptom is going to be a really big change for these neurodegenerative diseases.
Yeah, and I would also add that the process for getting a diagnosis, getting treatment of symptoms, and even relative to other, clinical drugs that are being developed, Unravel's a much more rapid response. It allows you to sort of aggregate data and then give you a fair idea of like what the realm of possibility is out there, so that we can sort of attack this disease in a lot more tailored fashion, particularly for boys like Luke, but for all kids with serious disorders. They don't have years. Sometimes they operate in terms of months. So it's a much shorter time frame. And Unravel can help with that.
Mm-hmm. And the idea too, I think that using already FDA approved treatments to repurpose those for conditions where today there is nothing, I think is a really novel idea, and it helps for a lot of clinical trials. It can take 10 years for a drug to get through the full FDA approval process, and actually be clinically available for kids like Luke.
Yeah.
So using this approach where you're going to look at already FDA approved items means that if we prove that this drug could be therapeutic for Luke, we can try it today. And Lukey has, most of the little boys with Rett syndrome just don't have a very long life expectancy. So we just don't have the luxury of waiting 5-10 years for a drug to get through the full approval process before he can start getting any kind of therapeutic benefit from it.
Mm-hmm. Mm-hmm.
So we're very excited to have Unravel test Lukey's RNA to figure out what's going on with him molecularly.
Yeah, I mean, especially like you said, it's really unfair that the boys are being excluded from clinical trials. So it's kind of like, well, what about Luke? What about all these other boys who need this? Do you have any messages that you'd like to send actually to families who have boys with Rett syndrome and feel like they don't really have a support, or just any message at all you'd like to say to families or to the world or just in general?
I think the biggest one is because the Rett community, and particularly the community of families with boys with Rett and other MECP2 disorders is so small, it could feel like you're alone and that there's not a ton of people to relate to, but that's not true. There's a ton of support systems out there. There's fighters like Arlene who've dedicated so much of their lives to making sure that, you know, we can advance treatments for Rett boys. So you're not alone. And there, as sad as it sounds, there's never been a better time to deal with a Rett diagnosis than today, because the technology is getting better. We have alternative options to therapies in terms of clinical drugs that are being developed, as well as, you know, platforms like Unravel, which can provide access to other avenues of therapy. So it's scary, it's tough, you're not alone, but we along with a lot of other really smart people are fighting to eradicate Rett.
Awesome. Thank you so much. I'm very sure that, you know, the insights you have provided today will be very valuable to our listeners, especially since we are talking about such a rare disorder. And I would like to thank all three of you for coming on today's show. I just hope all the best, and, you know, you're finding ease in the challenges you face, and just, you know, hope everything works out.
Thank you so much.
Appreciate it.